So I'm at the hospital. This is a pre-operative heart cath that we're doing today. I've had two valves replaced before, about 7 years ago. About 3 weeks ago, I started audibly hearing my heart making strange, sort of like sounds like a hoot kind of sound. So went to the doctor, did a echo and a esophageal echo, and it looks like both of the valves need to be replaced. And so we're getting a picture of the heart today, sort of pre-operative. So heart surgery, it's kind of a hard surgery, and we thought we would just kind of document this whole journey on what it's like to go through, and maybe it will help somebody else who has to go through it. Today's procedure, they're gonna take basically a camera. They're gonna do a dye, and they're gonna take a camera and take a scope up through my vein into my leg, and be able to get a better picture of the heart, the valves, and what they're doing, so to make sure my arteries are clean and they can see everything. So before the operation, there's no surprises. It's all a little scary. Like, I feel confident. I'm not too worried, but anytime you have any type of procedure and stuff, you always have a little bit of concern in the back of your mind. I won't see the surgeon for another week after this, so I'm not even sure when the operation's going to be for the valve replacement, but we're a little bit in limbo now until that happens. Unfortunately, Joan can't stay with me today, so she's going to have to come back and get me. And I don't know. I've never been through a procedure like this without Joan around, so it'll be a little bit weird to go through it and not have anyone there and have her have to come back and get me. So yeah, I've had this test before. It feels really, really weird. They put a dye in, and I guess they warm it up. They don't want it to go in cold, but it goes in warmer than your blood, and you feel it traveling through your veins. I really don't like the feeling of the test, but yeah, I guess it just is what it is. But it's not a fun test. I didn't like it the first time. I just maybe have to change my attitude about it and just try to enjoy the warm feeling instead of dreading it. But so with the heart cath, we got here around 6 a.m. and the procedure is supposed to take about an hour. So we got here at 6. The procedure is at 7:30. So there's a lot of pre-procedure kind of thing. So an hour and a half before the actual procedure. We're here. They put an IV in me, and I guess it's I don't know if it's a different gauge IV, but when they put the IV in, it kind of hurt. And needles always hurt a little bit, but they had to put it in twice. So this one hurt, I don't know, for whatever reason, a little bit more than before, but maybe because the gauge of the needle was bigger, I don't know. But so we have about an hour and a half until the procedure. The procedure is supposed to take about an hour, and they keep me here for 4 hours afterwards. So I'll be just hanging out for a while. And but anyway, so if you do have to go in for a heart cath, that's some information so that you kind of know what to expect. So they just came in and shaved the area where they're going to be, going into the vein, and because they have to tape it up then afterwards. They don't want it to, when they take the tape out, to take off a lot of hair or make it painful any more than it has to be. So the other thing is I'm not supposed to drive for 2 days, and Yeah, which I didn't know. But I haven't really been driving a lot lately anyway, so just been a little bit nervous. It's weird when you can hear your heart. You start to feel a little bit nervous about, you know, thinking your heart. You're very conscious of it, and you think, well, maybe it could just stop working, or I could have a heart attack, or heart failure or something. So I just haven't felt as comfortable driving recently, just because I don't know. But I've driven a little bit, but usually short distances, and but otherwise I've been letting Joan do most of the driving. So a little bit of advice: if you have to come in for a procedure like this, you may want to consider shaving the area that they're going to be going in before you come in, because they came in and shaved a pretty large area on me, like basically from my waist down to about mid thigh, and in the front, to be able to, and on both sides too, because they don't know which side they're going to go in. So you may want to shave, because they tried to clean it up with a little bit of tape after they shaved, but there's still a lot of hair on the bed, and I don't know. I'm a little bit particular like that. I don't like to feel little pricks of shaved hair on me. So if you do have to do it, may not be a bad idea to just shave a little bit yourself before you come in to have a procedure like this done. So you're not. Also, the other thing is, you're not supposed to eat. I've been having to take aspirin. They want your blood thin before this procedure, so I've been taking aspirin every day. But you're not supposed to eat. And normally I'm not really hungry in the morning, but for some reason this morning I'm really hungry. I'm waking up thinking about food, even though this is normal for me to not eat for several hours after this. Usually I'll just eat an apple in the morning. So, but for whatever reason, I'm thinking about some Thai curry with brown rice. It sounds really good to me right now. I don't know why, but yeah. Or Indian bindi masala. Oh, that sounds really good to me right now. Something with rice. I don't know why. I don't know when I'm going to be able to eat. I don't know if they feed me. That's the other thing we'll find out, is like, do they actually give you? I'll be here for 4 hours, so maybe they're going to give me something to eat. I have no idea. Problem is I don't eat meat, and generally I don't eat wheat. So I mean, what are they going to give me? Like iceberg lettuce? And I generally don't eat that very often either, but I guess it's better than nothing. So yeah, I don't know if I should have brought food, if I should have prepared for that, but or if I would even be allowed to do that. But anyway, something to consider. I'll update you guys and let you know what happens with that. You can hear it without it.
What is it? The valve? Is it a pig? I mean, what kind
It's
of
a pig valve, yeah.
valve? I think I remember that when from last time.
Yeah.
Yeah, I can imagine it. Where it's very quiet.
Yeah, you could hear it. Yeah.
And how long ago when you noticed the sound?
It wasn't that I noticed it. It just started about 3 weeks ago.
Oh, okay. So you posted it.
So I got to my office and it was really quiet, and I'm like, is there an owl outside of my office?
And
that's my heart.
It was your heart.
All right, so I'm about to go in for the heart cath pretty soon, just a few minutes. It was funny, we didn't quite catch it on film, but when the nurse came to listen to my heart, she put the stethoscope up to my chest. She, literally jerked in surprise at the sound, because it sounds very weird. Like you could audibly hear it without the stethoscope. In fact, the nurse who attended us last time we were in here for our esophageal echo, she sort of said from across the room, yeah, you almost don't need a stethoscope to be able to hear it. So that was kind of funny. But about to go in for my heart cath. Again, I just have to think of this whole experience as a good thing, because last time it kind of weirded me out to be able to feel the warm dye sort of gradually work its way through your veins. It's a very strange feeling, but trying to prepare my mind to just think, okay, just enjoy it, whatever it is, just enjoy it. Like, even if it's weird, even if it's unnatural, just enjoy the experience, because it's not something you normally are able to experience. So I'll continue. I'll let you guys know how everything plays out after the procedure, and how it went. All right, we'll see ya. Bye. See you in a few hours. All right, so I just got out of the procedure. Guess everything went well. Doctor said there's a lot of leakage from my valves. I guess they're just not closing strong enough, so they leak back. They did the dye test. It wasn't quite so bad this time. You have this warm feeling go all throughout your veins. You can feel it, going through you. It's a little bit weird, but it wasn't so bad. So that's good. Yeah, so that's the news. Looks like pretty severe valve leakage, so we're going to have to get new valves. And I meet with the surgeon next Thursday about that, so we'll see when I can schedule that. This heart cath, it wasn't too bad. It was there were some painful parts, but light pain. Nothing that I couldn't get through, but there was definitely some it wasn't all peaches and cream. And now I'm supposed to just keep flat as that whatever they put in there to help close the wound or whatever. I'm supposed to basically lay down and keep my leg flat for the next 4 hours. So I'm just laying down and hanging out for a while, and fortunately I have my phone, so I can not be totally bored just laying here. So yeah, it wasn't too bad. Some pains, a little bit of pressure as they were doing the procedure, but definitely wasn't unbearable. Yeah. All right. Talk to you guys later.